those deaf or hard of hearing and you need something transcribed, we will have this presentation online and available for you. So without further ado, I'd like to welcome the Director of the Department of Economic Development, Mr. Rob Dixon.
Thank you so much for being here today. I want to welcome more than 400 some odd fellow citizens who are on the call today. We have mayors from all across our state. We have county commissioners from all across Missouri. We have regional planning partners. We have community and nonprofit leaders. We have business partners. Really, the entirety of Missouri's economic and community development population is here with us on the call today. And we can't thank you enough for spending a little bit of time to talk about a really important topic. And that's really, how do we as a state, our state and our local community partners, work together to continue our economic recovery from COVID-19. Governor Parson has talked about this from day one of his administration. He talked about it just last week at the State of the State address. Investing in our state's infrastructure, investing in our state's workforce, really those building blocks of our economic foundation of our state is what's going to help us recover. And it's going to help us not just recover from COVID-19, but help us thrive into the future. So you're going to hear today a lot of information about a really important tool that our state is going to be able to have access to help communities all across Missouri recover from COVID-19. And that's, of course, our Community Development Block Grant Program. But there's a new portion of the funding and a new provision of the program that's specifically designed for COVID recovery. And we're really excited to start the conversation with you today. Not the state telling you what you should do, not the state suggesting what you should do in your community, but all of us working together to develop ideas for how we can best support you to recover from COVID-19 in our economy in your own community and across the state. So thank you for that. What I wanted to do, just show you a couple of quick slides today. You're going to see a lot of slides, so I'll keep mine to a minimum, but I want to show you the stakes that we're facing. You know it better than any of us, but I want to show you the stakes that we're facing in our state's economy and really the where we've come just in the last year. It's been a challenging year, a year unlike no other, as you know. And I want to show you exactly what we mean by that. So if you could put the slides up here to start off with, I'm sorry, if you can go back one. To start off with, at the height of, right before the COVID-19 pandemic hit, there were nearly 3 million Missourians that were getting up every single day and earning a paycheck for their families. That was actually record level employment for our state. And then the bottom fell out, of course, with COVID-19 and the economic recession that the pandemic itself caused. We lost 345,000 some odd jobs just about overnight. So many Missourians who were getting up every single day to go to work and earn for their families no longer had that opportunity. Consumer spending, we know this is an important measure of the economy, not just globally, of course, but certainly for our state, but also for communities and how that affects sales taxes. But consumer spending lost about 30%, and small businesses have been impacted just like no other sector in our state. Really tremendous challenges. But as you heard from the governor last week, we're starting to climb out of that deep hole. And Missouri is actually leading the country in our economic recovery efforts. 70% of those jobs that we've lost have already come back. That means that 70% of those 345,000 people who did lose their jobs are now back to work. And that's obviously really important for our state's economy. But more than that, it's important for families. It's important for citizens that they do have that opportunity. You know where that puts Missouri? 11th best in the country. And I think that's something that we should really be proud of. And it's nothing that any single entity can take credit for, but it's really a long history of working together, of having a very diverse economy. And that's what allows us to be more resilient to these challenges. And I think that's what the conversation today is all about. How do we help our state recover by becoming more resilient to economic challenges that we face? Consumer spending is still down from where it was before the pandemic, but it's recovered significantly from that low point back in the spring. And of course, as I mentioned, we're leading the country here. So folks, we've got a lot of work ahead of us. We should be really proud, and we should count our blessings over the year that we've faced and the challenges that we've faced, but we should count our blessings on how we've recovered from it. We have a lot more to do. All of those jobs haven't come back yet, and I know that there's still significant challenges facing your communities, and that's what today's conversation is all about. How do we continue the recovery, and how do we move forward into the future? So we thank you so much for your continued partnership. We thank you for your time today, and we sincerely look forward in working together with you as we go forward. Thank you so much. I'm going to turn it back to Daniel to lead us through today's conversation.
Thank you, Director Dixon. Okay, before moving on today, I'd like to reveal that we're going to be doing some interactive polling. So I'd like everyone, wherever you are at home, I'd like you to take a moment, pick up your phone. I'd like you to text to 22333 the message DED Communica 087. Okay, 22333. You're going to send the message DED Communica 087. You should receive a text reply that says, "You've joined DED Communications." So after we're done today, all you have to do is reply leave, and this way then you can send your text answers to the polling questions that we're going to be giving throughout this presentation. So let's go ahead and start with the test poll. Our test poll question today is, who are you rooting for in the Super Bowl? If you're rooting for the Kansas City Chiefs, text A. If you are also rooting for the Kansas City Chiefs, hit B. All right, as you can see on the screen, we've got mostly Kansas City Chiefs, but also, you know, the Kansas City Chiefs are making a run of it. Okay, it looks like everything's up and running well. Very good. Thank you all very much. We're going to have some polling questions all throughout this presentation, so stick to it. And we really want to hear everything you have to say. We want to get that feedback from you. So moving forward, I'd like to introduce Mary Rajek, who is the CDBG Program Manager. Mary is going to go over CDBG background. She's going to give you everything you need to know about Community Development Block Grant. Mary?
Thank you very much, Daniel. I'm going to take just a couple of minutes to introduce myself first. So as mentioned, I am Mary Rajek. I am the program manager here at CDBG, and I joined the team back in November. Prior to that, I've worked with DED for about 2 years, and prior to that have been in economic development in general for about 13 of those years. And so within that time, I was acting oftentimes as a consultant to communities or as a community economic developer. So more often than not, I found myself on your end of the stick, wanting to seek out some CDBG grant funding for my municipality or for my client. And so I bring that customer perspective to the team here at CDBG. Go ahead and advance the slide, please. So before we get started into mine, I also have a couple of polling questions. We have a lot of folks that have registered for today's event, a lot of people in attendance, and we know that we're all a motley crew, right? So I'd like to take a moment to ask you what type of organization you represent. And so we have text A, if you're a COG, elected official, please text B. If you're a local government, C, state government, D, nonprofit, E, business F, and other text G. So please go ahead and take a moment to let us know who you are and where you come from. Watching these polls come in is pretty fun, so I hope you are getting the joy out of there. Looks like we have a lot of nonprofits are in the lead, local governments, RPCs. We have a great representation here from all across various sectors, few businesses. This is fantastic. Thank you all. And I will have just one more question for all of you. So not only am I wondering who you are, but I'm also wondering to what extent you're familiar with CDBG itself. And so my next question to you is, have you engaged with CDBG programs before? Maybe you have submitted a state application because you're part of a non-entitlement community. Maybe you've submitted a local application in your entitlement community. Maybe you've worked on a project in general with a applicant, or maybe all of the things I just said were kind of Greek to you because you have no CDBG experience. Go ahead and let us know so we kind of have a level set for when we have our Q&A later. All right, looks like we have quite a few people who have never used CDBG before. We anticipated that, so that's great to know. Otherwise, looks like we have a lot of experience as well with us in the virtual room, so that's fantastic. All right, next slide, please. So just very briefly, I'm going to give an overview on just CDBG program in general, the 101 on CDBG. First of all, I just want to note that it was created in 1974. That means it is 47 years old. As you know, the federal government can make a one-year program very complicated indeed. So just imagine how it is when they've had 50 years to fiddle with it. So as you might imagine, it's pretty complicated to work through, but we are here to support you through that process. The funds originate out of the federal HUD, or Housing and Urban Development, and they are administered here through the state with Missouri Department of Economic Development. Go ahead. So the basics is that HUD will determine how much money each of the states get. We then have to adhere to various requirements within the Code of Federal Registration for us to be able to use those dollars, and we create action plans for the use of those dollars. Our conversation here today is part of our action plan development. In this case, it's an action plan amendment to our 2019 action plan to be able to use those dollars here in the state. We leverage local participation as well as our expertise here at the state level to create those action plans, and then we submit those to HUD. HUD will determine if they want to approve that outright, or they might bring it back to us for some changes and updates so we can get that to approval. Once the action plans are approved, we can then receive a grant agreement from the federal government, and then in turn, that grant agreement enables us to distribute money to you locally. Next slide. So in general, looking back, if we're looking at the regular allocation of funds, the annual allocation, this is most often where these funds are spent. Most often we will find funds are being spent on public infrastructure projects, followed by public facility projects. We also have a real keen eye towards job creation, as you might imagine, being part of DED, but we also have a need for administering those funds, making sure that all those funds are in compliance and projects are moving along. And that's where you see both local administrative dollars occurring as well as statewide administrative dollars being spent. So in the statute for CDBG, we have baseline requirements, which is to say national objectives that must be met. The foundational national objective for CDBG is that of a low to moderate income beneficiary, which means that 70% of all of the dollars that the state spends for CDBG must be related to providing a benefit to low and moderate income persons. Additionally, we have the opportunity to eliminate slum and blight, as well as meet urgent needs. So typically, if you're applying for CDBG dollars through the state, it will be a non-entitlement community that does so. A non-entitlement community is a smaller community, which is to say cities of a population of 50,000 or less, and counties with populations less than 200,000. In special situations, entitlement communities, which are communities of higher population, have the opportunity to partner with the state on CDBG funds. In that case, usually it has a relationship to either a disaster that has occurred, federally or presidentially declared disasters, or in this case, CDBG CV dollars. Finally, how can your organization access dollars? Sub-applicants are eligible to work with their local units of government to become applicants. So the local unit of government must be the lead applicant. A sub-applicant can be a taxing district, such as a wastewater taxing district, or a nonprofit. However, it is important to note that businesses and individuals cannot apply directly for CDBG funds. Next. All right, with that said, I would like to introduce Michael Lanahan. He is the director of the Business and Community Solutions Division here at DED, and he's going to give you a deep dive on the CV funding.
Thank you, Mary. Much appreciated. It's great to be with you all this afternoon, virtually or otherwise. And pleasure to virtually meet those of you whom I haven't had a chance to meet in person. So in this section of the presentation, I'm going to talk to you about the CV funds, about their background, how they can be used, and some of our thoughts from the state perspective on design principles of program implementation and some initial statewide priorities before we get into the local priorities, critically, your feedback from the survey later on in our presentation. So let's jump into it. So first, the background. Many of you are familiar with the CARES Act, the major federal legislation passed last year to provide stimulus aid against COVID-19. It included many tranches of funds to help on a variety of fronts with COVID, including $5 billion of CDBG to help communities prevent, prepare for, and respond to COVID-19. Now, Missouri's share of that was about $43 million, and that doesn't include some allocations that entitlement communities across the state received from that as well. Now, of Missouri's $43 million, about $25 million of that is restricted to non-entitlement communities, and 18 million is available to entitlement communities as well. Now, Mary outlined most of the CDBG requirements earlier in her section, and CEV funds are largely the same. They largely have the same requirements, such as national objective. Has to meet national objective. At least 70% of it has to benefit low to moderate income individuals. The biggest difference that CEV funds have is that they must have a direct tie to COVID-19 preparation, prevention, or response. Let's talk about what that means. So prevent, prepare, respond. There's a lot of overlap between these categories, so don't get too hung up on it. Prevention, it's an activity to stop COVID before it starts, before an outbreak starts. Preparation, an outbreak may be underway and you're trying to contain it, come back from it, et cetera. And then response, the activities you do after an outbreak has occurred, whether that's on the economic recovery front, addressing long-lasting health impacts or homelessness and some of the social impacts, things of that nature. So every project using CEV funds must prevent, prepare, or respond to COVID-19. Let's take a look at how CEV funds can be used. Broadly, they fall into four main categories. The first is infrastructure, including public facilities. These funds can be used to, for example, help a medical facility expand to accommodate more COVID-19 patients, or to accommodate overcrowding at hospitals due to outbreaks. Special economic development activities is the second category, and this largely focuses on assistance for businesses. That can include job training or retraining for businesses that have had to pivot their business model and retrain their employees. That can also include technical assistance for things like e-commerce training, as e-commerce becomes an even more vital part of our everyday lives. It could also include financial assistance, such as loans or grants to some of the hardest hit industries across our state. And that would be in addition to the resources available in other federal stimulus bills, such as the PPP in the latest one back in December. The third major category is public services. This is a very broad category that covers anything related to delivering a public service. There's many healthcare needs that will fall under here, such as healthcare equipment. PPE could fall under here as well. This could also cover some needs like training healthcare professionals to make sure there are enough boots on the ground for the front lines healthcare response against COVID. And then the last category, planning, capacity building, and technical assistance. Basically, planning grant for any of the previous categories, just about anything short of implementation within that plan. On the capacity building and technical assistance side, that could include consulting services for local governments looking to implement a CDBG grant or address other COVID-related needs in their community. So just a quick summary of what we talked about so far to highlight the COVID fund. So Missouri's been allocated about $43 million from the CARES Act. All of your projects, each project that your community puts together must have a tie back to prevention, preparation, or response to COVID-19. And there's a lot of different uses for those funds. So next we're going to talk about some of the design principles that we're keeping front and center as we build out program implementation for state CDBG CEV funds. So we're really focusing on three main design principles. First, flexibility to account for emerging needs. Outbreaks ebb and flow. It's happened across our state since March when everything really came to a head. And we want to make sure that the CDBG CEV funds can pivot accordingly to address the needs at the time. So we're actually going to flip to the next slide real quick to show you what that looks like. So instead of identifying very specific uses for the CDBG funds, we're identifying broad categories that uses of the funds can fall into, literally the categories that I just described. So 30% of the funds are going to each of infrastructure, economic development, and public services, with about 7% to planning and 3% for state and local administration. And we can change these around as needs change over time. But really, these categories are what we're going to be looking for, and we'll be able to pivot pretty quickly without any action plan amendments. So back to the other slide. The second design principle is targeting unmet needs. And what we mean by that is there are unprecedented impacts and hardships that COVID-19 has brought our communities on the health front, on the economic front, there's also an unprecedented wave of resources from various federal stimulus packages that can be used to address those needs. We want to make sure that the state CV funds go to those truly unmet needs that don't have other resources that could provide for them. So some other resources that come to mind are also from the CARES Act, the Coronavirus Relief Fund, or CRF, which provided direct allocations to the state government and to each county government in Missouri to tackle a broad variety of COVID-related needs. There's also the CDBG CV funds that entitlement communities have already received. And one big one that's on the horizon, the state was recently awarded over $300 million in rental assistance, which will be administered by the Missouri Housing Development Commission. So more details on that to come, but for those needs, we really encourage applicants to look to those resources first and make sure that we use CDBG CV for needs that otherwise couldn't be addressed. And the third design principle, we want to ensure equitable access to communities for these funds. There are many communities across our state that have many, many needs. And what I mean by this is, we're not just going to do one project for $43 million and call it a day. We want to make sure to spread the impact and the positive benefit to communities across the state. So keeping these design principles in mind, let's jump into some of the initial priorities from a statewide perspective. Now, big asterisk here, this will be updated to incorporate your feedback from the survey responses, which we'll talk about in just a minute. I want to be absolutely clear about that, but I think you'll find that there's a lot of overlap between what we see from a statewide perspective and what you're saying from a community perspective. So on these priorities, let's just go through them. First and foremost, healthcare response. Without healthcare, you don't have an economy. Anything COVID response recovery has to start with healthcare needs. Next, of course, Governor Parsons' main priorities of infrastructure and workforce development. There were critical needs pre-COVID and even more so now. The other priorities that we have highlighted on here come from a combination of statewide data collected on a variety of data dashboards over the past year, highlighting economic recovery, social impacts, and healthcare stats, as well as customer engagement prior to the survey that went out that all of you responded to, and planning efforts for any of the above for the planning grant section. So again, these will be updated based on the input from you, our customers who represent our communities across the state. I'm really excited to jump into that. So I'm going to turn it back to Daniel Engler, who's going to walk us through your survey results. Thank you.
Thank you very much, Michael. Okay, so earlier this month, we sent out a survey to all of you, and we wanted to find out what were the most pressing needs, unmet needs in your community. We got back a lot of response. Over 600 people responded to this survey, which is pretty good considering it wasn't out there for very long. And a lot of strong opinions, but we got some great feedback. So let's talk about those results. First of all, take a look at this map. You can see the number breakdown across the map. Every single part of Missouri, save for a couple here or there, is represented in this survey. We had people from the Northwest, Northeast, the center, the South. You can see big city representation, but you can also see down in the Boot Hill, we had plenty of people logging in and giving us their thoughts on what their unmet needs were. So this was fantastic in terms of outreach. Let's start to look a little bit more about that outreach. So the top cities represented were Kansas City, St. Louis, Springfield, Independence. You can see listed the top counties. And so 50% was cities, and we had a lot of people that were more rural. If you look at this, the roles represented and people who had submitted the survey results are very diverse. We have government staff and we have RPCs, elected officials, but you can see from this chart, a lot of people either listed other or they're just residents, which is fantastic. We got a lot of great feedback from people, everyday citizens all across the state of Missouri. And the population of the places that we received the response from were diverse as well. So we had a lot of people from places that had less than 5,000 people. We had people, pretty good number of people from the 10,000 to 25,000 range. We got a lot of people from the cities and the high population areas as well. So we asked you a lot. We asked you about your business needs, your community needs. We asked you about broadband and homelessness. But above everything else, there were a few topics that kept popping up over and over again that weren't available to be rated, but were very important to you as the people who were taking the survey. These top three categories were vaccination distribution, extremely important to you, mental health needs that popped up over and over again, and childcare. Well, let's talk about some of those most pressing needs in the business community. So you said grants and loans were extremely important to you, followed closely by equipment and technology. Some other business needs that we hadn't mentioned were working capital, grants, short-term loans, technical assistance, training, information sharing, housing assistance, energy, and utility assistance. Moving on to the community, your most pressing community needs were medical equipment and supplies. So also food delivery was big on your list, as well as PPE for first responders and facilities for COVID response. Some other unmet needs that weren't represented that you also wanted to have mentioned: increased medical staff, equipment facility improvements, housing assistant, food and critical supplies access, and then also mobile testing was a frequent recurring theme. Moving on to housing and homelessness, LMI, low to moderate income rental assistance, was very important to you, followed up by mortgage assistance and utility and shelter assistance. Some other unmentioned needs: homeless emergency shelters, housing rent vouchers, housing construction, weatherization improvements, mental health support was a big one. Mental health support came up over and over again. So thank you very much for letting us know. And on broadband and internet, affordable broadband was most important to you. As we're all working from home, we're doing telehealth, telelearning. The internet is more important than ever. You said affordable broadband and equipment was most important to you for remote learning and everything we have to use the internet for these days. So let's move on to our third poll question. What potential uses for CDBG CV funds do you believe would best help your community? Is it infrastructure? Send in A. Special economic development activities, B. Public services, C. Or planning capacity, building, and technical assistance, send us D. A, B, C, D. It looks like public services is pulling away. Oh, it's a close run between that and infrastructure. All right. Some really great. It looks like infrastructure and public services. Thank you all so much. That's good to know. Okay, so now that we've gone over the survey results, let's talk about application guidelines and requirements. So here coming up very soon, you're all going to be wondering, when can we put in our application? What do you want from us in terms of information on our applications? Well, let's talk about that for a minute. So CDBG CV funds have mostly the same requirements as normal CDBG, plus a direct tie to COVID-19 preparation, prevention, and response. Now, typically, we're going to want a general list of things from you. So you could probably prepare yourself, be ready for some of the things on this list that we're going to be looking for: applicant information, general project description, proposed project budget. How much is this going to cost? Letters of commitment for any proposed matching funds. So if you're going to have assistance in funding, we need to have letters of commitment. Local governments and sub-applicants, if applicable, financial statements, national objective documentation. So everything we talked about with those national objectives, we need to have documentation on that. Support letters from state representatives and state senators, very important. Preliminary engineering or architectural report, and proof of status for nonprofit organizations. I know we have a lot of nonprofit or not-for-profit organizations in the audience today, so proof of status, we're definitely going to need that. So let's talk about entitlement versus non-entitlement areas. What's the difference when it comes to CDBG CV? Well, CV1 and CV3 allocations, and that's approximately $25 million combined, are restricted to non-entitlement communities. And then the CDBG CV2 allocation, which is approximately $18 million, is available in both non-entitlement and entitlement communities statewide. Entitlement communities are cities and counties that typically receive their CDBG allocations directly from HUD, including allocations from CDBG CV1 and CV3. So you can see a list there of what some of our entitlement communities look like. And if you'd like a full list, all you have to do is go to the Department of Economic Development website, ded.mo.gov. Go to the under community, you can go to this community development block grant page, and you can find a complete list of the non-entitlement and entitlement areas completely broken down. So Moving forward, let's talk about duplication of benefits, which is an analysis that has to be completed before providing CDBG CV assistance. So you should only pay. We should only pay for unmet needs, not needs not met, or as well as needs not met. If a DOB occurs, and that's duplication of benefits, grantees must repay the CDBG CV grant. This does not include reimbursement of costs previously incurred by grantee as authorized under the CARE Act. And finally, DOB analysis accomplished in varieties of ways. So will require self-certification or a questionnaire. And finally, on application requirements, must comply with existing environmental rules and regulations. That hasn't really changed. There's environmental reviews for CV19 projects presented and published. It was published on December 10th, 2020. And additional details on ER, all of our other applicant regulations, those are all going to be available on our website as well as in that FAQ document that we talked about before. So if you're still confused about what makes a CDBG CV grant different from every other kind of CDBG grant, I'd like to present you with the eligibility cookie test. So what makes this cookie? Well, you've got the 2 chocolate crunchy outsides, and of course that's your standards of, does this activity meet the national objective, like we've been talking about? Is the activity eligible? Is this something that we can even do? But the thing that really ties it together when it comes to CV funds is, does this activity prevent, prepare, or respond to coronavirus? So without that middle section, it's not the cookie we want. So if you're confused, always look to the eligibility cookie test. So what happens next? DED team will incorporate stakeholder input into the final program design, just like we're doing right now. We want to hear from you. We want to be able to know what we need to include. DED publishes the action plan for 5-day public comment period. It's very broad. Won't get into the same level of detail that we discussed today. DED submits the action plan to HUD for approval. Then we'll have FAQs posted to the CDBG CV website next week, probably. DED will notify everyone when the application is posted online and the application cycle opens. So we'll let you know when that application cycle is open. You can find that application online. Then once applications start coming in, they'll be reviewed and approved on a rolling basis, accounting for identified state and local priorities. Like Michael was talking about earlier, all those design priorities, those are what we're going to be looking at when we go into this application rating process. So let's move into some frequently asked questions. We're going to have room for some of your questions that you're typing in, hopefully right now. But let's try and predict some of those and look at some Q&As. So who can apply for CDBG CV grants? Units of local government. So like we were talking about earlier, 25 million available to non-entitlement communities, 18 million available to non-entitlement communities, as well as entitlement communities. Here's another question. How can communities reasonably link their CDBG request with COVID-19? Well, I'll tell you, like HUD tells us, document, document, document. Documenting how the activity prevents, prepares for, or responds to COVID-19 is going to be key to linking this. Let's hear another question here. How can other entities, for example, not-for-profits, a lot of the people in the audience today, and other service providers participate in the CDBG projects and applications? Well, very simple. You partner with your local unit of government as a sub-applicant. For urgent need, how does a grantee show the activity is urgent and poses an immediate threat? The CDBG CV funded activity must be alleviating conditions that became urgent within the past 18 months. Subgrantee needs to show that no other funding was available to address this urgent need. And if Treasury funds were on hand that could have addressed that need, it might not qualify. Of course, we're going to have that action plan online soon, so I would definitely check back on the action plan to see for more details on what will and what won't qualify. Here's another good question. May CDBG CV funds reimburse any costs prior to grant execution? Yes. The CARES Act provides that CDBG CV funds may be used to cover or reimburse allowable costs to activities to prepare for, and respond to coronavirus incurred by a state or locality, regardless of the date on which such costs were incurred. The authority is broader than the authority to reimburse costs with our other CDBG projects. But just one note on that: in order to be eligible for reimbursement, a pre-award cost a subgrantee would need to document that it can support a determination with respect to 24 CFR. Okay, poll question number 4, everybody. How likely is it that your community will apply for CDBG CV to address an unmet need? All right, polls open. A will get you not likely, B will get you somewhat likely, C very likely, D not sure. Ooh, seeing a lot of very likelies. All right, somewhat likely, very likely, and not sure. That's what we like to see. All right, thank you all very much. Okay. Now, before we move on to the final part of our presentation today, I just want to throw this out there. If you have any questions, if you'd like to contact us, get a hold of us for anything you might need, the best way to get a hold of us is through this email here, mocdbg@ded.mo.gov. And I'm going to go ahead and have that email pop up after we're done with questions for those who want to see it again. So moving on. I think you've got a lot of questions, and hopefully we've got some answers for them. Like I said at the beginning of this presentation, we have DED staff on hand who have been wrangling some of your questions all throughout this presentation. And I'm just going to ask them what is on your mind. Marina, what's our first question?
All right, so our first question is, would indoor air quality technology needed to prevent the spread of COVID count as a part of infrastructure such as ventilation?
Okay.
I would say it's pretty specific. At the same time, though, if we're looking at public services grants and things of that nature, it is quite likely that that would be something that would be available. We'll continue to do research on it, but that does seem like what would be an eligible expense, depending on, of course, the applicant and sub-applicant, if applicable, as well as long, the meaning of the national objectives.
Okay. Okay. And I'll make sure to repeat the question. That one was about, what was it, air purifiers qualifying?
Air quality technology needed to prevent the spread of COVID.
Okay.
So I'll repeat the question. My apologies. The question was, would indoor air quality technology needed to prevent the spread of COVID-19 as part of infrastructure, such as ventilation, be applicable or eligible? And so going back to my answer, assuming that all the other eligibility requirements are met, it's quite a possibility that that would be there depending on applicants and sub-applicants as well.
Okay. Candace, what's our second question?
Could we apply for the service activities across multiple counties?
Can you apply for the service activities across multiple counties?
Do you want to tackle this one, Mary?
I was going to say, that's a really good question, and we need to actually work with HUD to make sure that we can get that information. I'm not sure that we have that on hand.
Yeah, I think my biggest question here would be who the applicant is.
Right.
Because each county could potentially apply. As far as a joint one, we'd be happy to dig in and do some research on that. And we'll put an email address up here at the end, so you guys can reach out to us with any other questions. But this is one we're happy to dig into and get back to you with a more concrete response.
Amy, do you have something that you'd like to add?
Yes. Standardly, CDBG will allow for multiple local governments to apply together. We would require that the applicants would commit to an intergovernmental agreement between all of the potential applicants and then designate a lead applicant. But that absolutely is a possibility in our regular CDBG program, so I shouldn't see it be a problem for CDBG CV.
Great. Did everybody hear Amy okay on that? Yes, that was good. All right. Next question.
Well, Amy, what's our next question?
Did the speaker say that nonprofits can't apply directly for these funds?
Right, so a nonprofit would be a sub-grantee alongside a local unit of government. So a local unit of government would be the lead applicant on the application, and a nonprofit would then be a sub-grantee under that local unit of government. So it would require cooperation, working together with your local unit of government to apply.
Okay. Marina, do we have another question?
Yes, so we have a few questions about the duration. So we have a few questions about the duration as well as the general starting time for the application cycle.
Okay, so starting time with the application cycle, we don't have an exact date just yet because we went through what happens next. Big process. We've got to go through HUD with our action plan, make sure we get that approved. We need to make sure that we incorporate everything that we've had today and responses we might get from you to that email. Make sure that everyone's voice is included in this. Then once we get the application cycle up, we'll make sure to notify everyone. We'll probably have a blast email, and we'll make sure that it's posted and available on our CDBG CV website, which we have a brand new separate CDBG CV webpage you should go check out.
I think another piece of that, how long will it be open? I would just say that the applications we are intending to accept on a rolling basis. We do have priorities that we're going to be looking to fund and make priorities first, which we covered in this presentation. And again, the presentation will be available online, both just the slides, the video, as well as a transcription. But we also are going to be looking at those that are non-priorities once we have rolled that through. The intent is to spend every last dollar of our CV allocation on CV-related projects. And so we do not intend to hold on to the money in any way, shape, or form. That's not what we're here for. We're here to get it out. So hopefully that helps with answering that question as well.
Okay. Candace, do we have another question?
Will the timing process be expedited with the COVID fund related? Or will the traditional process of reviews, contracts, and committees be utilized the same as traditional CDBG?
So all of the regular CDBG requirements, generally speaking, do apply. There are some minor waivers that are available when it comes to things like integrating for public comment, things like that. But generally speaking, all of the traditional rules do apply.
Okay. Amy, do we have another question?
Would a local government include regional planning commission or a county commission? You want me to answer things? Okay.
Sure.
So HUD requires that we fund CDBG funds to units of general local governments. Those include cities, counties, villages, and towns. So if you aren't one of those, then you will have to work with a city, county, village, or town to apply on your behalf, including townships. So regional planning commissions would need to work with your eligible unit of general local government. The county commission is the county, so the county would be applying.
Okay. Marina, do we have another question?
Yes. If a city or county has another CDBG fund open, can they apply for CV funds?
Yes.
Yes, they can. Long story short, yes. If you have another CDBG project going, you can go for CV funding. Okay. Candace.
If your service area includes both entitlement and non-entitlement communities, can you still apply if you want to apply with multiple jurisdictions?
Any thoughts, Amy?
Go ahead, Amy.
It depends on which pot of funds you would be applying under. The CDBG CV1 and 3 are only eligible for non-entitlements, but if there was to be a participating entitlement community as a applicant or a sub-applicant in an intergovernmental agreement, then that would have to apply under the CDBG CD2 pot of funds.
Okay. And Amy, do you have another question for us?
If an entity has already received CRF monies, are they eligible for CDBG CD funds?
Yes.
Yes, they are eligible for CDBG CD funds. Say that 10 times fast. However, it is notable that if an entity has not spent their CRF funds or things of that nature, that will be something we'll have to examine. And again, we have also a situation where we need to take care of duplication of benefits because CV funds must be used only for unmet needs. And so where there are instances where there was dollars available, but not leveraged in advance of applying for CV funds, those will need to be examined on a case-by-case basis.
Okay. Marina, what's our next question?
Is there a per application maximum dollar amount that can be requested?
I'll talk to this one. So in the design principles we laid out, number 3 was equitable access to all the communities across the state. So that will be something we examine with the method of distribution. Of course, we also understand that certain areas have had extraordinary circumstances. Like if you look at a geographic map of unemployment levels or certain healthcare statistics, there are some jurisdictions that have been affected in an outsized proportion compared to the rest of the state. So that'll be something that we accommodate as well. But that'll come out in the application that'll roll out in the next couple of weeks.
Okay. Candace, what's our next question?
One of our attendees says, I work for an organization serving homeless individuals. Can we apply for funding to improve our healthcare facility if we are providing healthcare services for people experiencing homelessness and in parentheses, not necessarily COVID patients?
I think I can tackle that. So first off, as Amy's described, the applicant has to be a unit of general local government. So you'd have to partner with the city, county, town, or village. But as far as the intended use, like for a homeless shelter, yeah, the residents don't have to be COVID patients. You know, the CV funds cover some of the indirect effects of COVID as well, and homelessness has spiked in many areas. There have been rent moratoriums and some mortgage relief in some instances, but homelessness is up, and that they don't necessarily have to be COVID patients in order to qualify for the CV funds.
I think it's important to just also emphasize with that, though, we need to have a direct tie back on if it prevents, prepares for, or responds to COVID-19. And so if you're thinking about how to, apply a filter for your thought process around how to do this, you really need to be able to document the direct tie back for prevention, preparation, or response to COVID-19 in any instance, including this one.
Okay. Amy, what's our next question?
Yeah, I think we might have covered this a little bit already, but one of the questions that seems to be recurring is, are the funds available on a first come, first served basis?
Well, we're doing a rolling basis, which Michael, would you like to explain exactly?
Mary, you kind of summed it up with the priority area.
Yeah, so for when it comes to funding, again, we are accepting applications on a rolling basis. The one thing that we do not want to do is have one region's urgent need stack up against another one in a competitive nature. However, we do have priorities from a funding perspective that we outlined within this presentation that really kind of articulate what's going to come to the top for us as far as getting the dollars out. So while it's not competitive and it's what we plan to do is again accept on a rolling basis and accept them until and approve as we can until the funds are expended.
Okay. Marina, what's our next question?
Is broadband construction eligible if the infrastructure will be owned by a nonprofit like a rural electric cooperative?
I think that is one of those that we will need to definitely explore with HUD. There are a few challenges that we have had historically with broadband infrastructure, really tying back to the national objective, which is to say LMI, urgent need, and elimination of some of the and blight. So within those regulations, we've had some challenges. So it will come down to who is the ultimate beneficiary. As far as the theoretical applicant, as the applicant is a nonprofit, if they're working as a sub-applicant with their local unit of general government, from an applicant standpoint, that shouldn't be an issue. The real problem, or the challenge, I should say, it's not a problem, but it's a challenge, comes into making sure that we're articulating that the beneficiaries meet our national objective. And so that will be the hurdle as you're working through your application to ensure that you're addressing.
Long story short, it'd be challenging, but it'd be a fun one to try to figure out if we can make it possible.
Right. And I think, and I'll just build on this, one thing that has become extremely, if it wasn't evident before, it is absolutely clear now. Broadband infrastructure is a requirement for participation in the world's economy today. From having a job, applying for a job, education, today's presentation, healthcare, it touches on a lot of things. And so to say that, being able to bring it in within the CDBG requirements, that's one thing, but there's no doubt that as a department and as a state, that is something that is important moving forward. So I just want to give that clarification.
Okay, Candace, what's our next question?
Normal CDBG guidelines restrict the number of applications a community can have open at one time. Since there are a lot of sources of grants currently, CDBG, mid, DR, regular, and now COVID, what are the restrictions about communities having multiple applications?
And I think we answered this one earlier, but there would be a limitation on a community that has an open grant application, submitting an application for a CV grant as well.
Okay. Amy, our next question.
Next question I'm seeing is how much is left of the 43 million in CDBG CV dollars? And I can go ahead and say that it's all left right now, right? Yes.
Yep.
So
And
it's
just
all available.
and going back to the steps that Mary outlined in CDBG 101, following your input and our time together this afternoon, we're going to submit the action plan amendment to HUD. It'll go out for public comment first, so you'll see an email blast about that, and it'll be really basically those broad categories that we shared with you earlier. And then after 5-day public comment period, we send to HUD for approval. After they approve, they send us a grant agreement that actually transmits the funds, and then off to the races.
Okay, Marina, what's our next question?
Could an advanced metering infrastructure, or AMI, system be considered infrastructure in the CV application?
Advanced metering.
I think I can provide context.
Okay.
Okay.
So thanks for the question, Lance. And advanced metering infrastructure, if I'm remembering correctly, is a metering system for your water distribution system. And it's a way for you to have the, telecommunications basically read the meters remotely. And so in due part to the fact that you've had cross-contamination with the virus by having to have people go into the office and then go read the meters. And so that's definitely a potential for an eligible activity, and just making sure that you're clear with the tie back to it being in response to or preventing or preparing for the COVID-19. That would be something you would have to make sure that you clarify on, but it's absolutely an eligible activity as far as a CDBG activity would be concerned.
Okay. Marina, what's our next question?
For an infrastructure project, are funds limited to $5,000 per household as in regular CDBG funds?
I would say that is something we have not yet determined. We are clarifying our method of distribution at this time. And part of that also comes into this community engagement activity. And so I would say that at this time, we have not determined if that will be a limitation on infrastructure at this time. again, working through that on our method of distribution as well. So thank you for the question. And I appreciate that it was flagged out specifically. Thank you.
Okay. Candace, what's our next question?
Could CDBG CV funds utilize the acquisition of a hotel or other structure to be utilized as a homeless shelter due to capacity limitations imposed upon homeless shelters due to social distancing and increase in homelessness during the pandemic?
Again, that's pretty specific. I'm not entirely certain at this point. I would say that theoretically, it does seem to fit a lot of the different categories. When we think about public service, we have to, make sure that we're articulating the tiebacks to not only COVID-19, respond, prepare for, and I missed the prevent. Thank you. My apologies. As well as all of the eligibility requirements under CDBG, generally speaking. If it's as we're building out our action plan, one of the themes that I'm hearing in this conversation, and I also noted a lot of our attendee list was related to homelessness in particular, which I found interesting, and that's something that we definitely will note as we're building out our action plan amendment and refining it, because I think that was one of those areas that we didn't realize would be as important to our locals as it apparently is. So thank you for that call out.
Okay. Let's see, Amy, what's our next question?
Will special populations such as elderly or disabled populations be counted eligible for assistance as per regular CDBG program and eligibility? And the answer to that would be yes, because all of the same national objectives would apply. Elderly, as long as it meets the HUD definition of 62 and over, would be considered a limited clientele of persons who are presumed to be at least 51% low and moderate income persons, and disabled meets the same criteria by HUD's definition, so both of those would be considered a limited clientele LMI benefit.
Okay. Marina, what's our next question?
Is there a recommended amount of matching funds, or is it still give all that you can?
I think give all you can, right?
I'm sorry, can you repeat that?
The question is there a recommended amount for matching funds, or is the idea to still give as much as you can?
Yes, so the idea is, similar to traditional CDBG dollars, it is give as you can from a matching perspective. And similar to, or as articulated previously in the presentation, all of the normal application requirements apply, including having your matching funds articulated and identified within your application itself. So that is still there, and it has not changed.
Okay. Candace, what's our next question?
What are the reporting requirements?
Reporting requirements? Reporting requirements, as far as I understand, are going to be the same as they normally are with every other CDBG project. Of course, with the applications, document when it comes to tie it back to COVID. But as far as reporting requirements, I believe it's the same as every other CDBG project.
To our understanding, that is the case. There is additional guidance on the HUD website at this time, and they did publish, and this was alluded to during the presentation, they did publish a webinar regarding the CV funds on December the 10th, 2020. And I do encourage folks who are interested to take a look at those HUD guidelines as well to get an understanding of what some of those requirements are, especially considering, in the group today, a lot of the folks here on the call, don't have experience in CDBG. And so taking some time to take a look at what's available on the HUD Exchange website, which is quite comprehensive, to get some information, I would say that's a great place to start to kind of get your legs under you when you're moving forward in this route.
Okay. Candace.
Follow-up question on that one. Can a community perform an LMI survey after the application was sent to CDBG?
It depends. CDBG allows for LMI to be the national objective for limited clientele on, we consider limited clientele on if they're going to serve a population and survey those specific users of a facility, such as we've used in our early childhood education centers, is we would survey those families that end up being the users of the facility. So that is on a survey after the fact, but standardly, if you are saying an LMI area benefit, then the LMI area benefit determination must be made prior to the application.
Okay. Amy, do you happen to have another question?
Yes.
All right.
Is this CV program subject to change based on future state or county stimulus funds? Are those funds that are needing to be exhausted first before CV funds can be considered? I'm unclear on what other funds must be exhausted first. That speaks to Mike.
Sure. So going back to those design principles we talked about earlier, the second one was targeting unmet needs. So we want to make sure that these funds, the CV funds, are really used for those unmet needs that don't have other resources that could apply for them. So we would strongly encourage communities that have alternative resources, whether it's remaining CRF funds or something that comes from a subsequent federal stimulus, to really target those. One of the characteristics about the CV funds that I don't think we mentioned today, they have a longer life than the CRF funds. So CRF funds, after the latest stimulus, they don't expire until the end of this calendar year. CDBG CV funds, we have to use most of them within 3 years. So longer timeline. And with regard to unmet needs, we would strongly encourage communities to use those resources that have broad uses, that have a shorter timeline before resorting to the CV funds.
Okay. Marina, what's our next question?
When you say nonprofits should apply as a sub-applicant within a local government entity, does that mean, for example, the city applies for funds, then put out a notice of funds available for the nonprofits to then later apply?
I'll take that question. The way that our program works with the state of Missouri is that a city would already have a predetermined agreement with that nonprofit as a sub-applicant. So they're only going to submit one application on behalf of that one nonprofit's project. They're not going to have to, the nonprofit won't have to apply to that unit of general local government. So there wouldn't be a competition at the local level. It would just already be predetermined when the unit of general local government submits that application. There's already a sub-applicant agreement in place with that nonprofit to apply for those funds on their behalf.
Okay. Candace, you have another question for us?
Can these funds be used to support activities related to testing of influent at their wastewater treatment plants as an early warning system of potential COVID-19 outbreak in that community or area served by that regional wastewater system?
Michael, you want to take this one?
I would, and this is kind of like Mary said, we can't get legal advice over WebEx, but that sounds something like that could potentially fall under public services. I mean, that's you have the tie to COVID, trying to detect it early and prevent potential outbreaks. And that sounds something that would definitely be worth exploring.
I also just want to say, I know that the state of Missouri DNR has been working collaboratively with University of Missouri on that particular project. And so I would certainly reach out to your local DNR office to get some insight and intel as to whether or not that is something that's already active in your community, or if you can get on a list. So there's funding at the federal level that was provided to the state of Missouri under a different heading to conduct that type of activity. And so I would just, and I know that they've been expanding the list of communities and locations of that affluent testing. So please do reach out to that agency just to see if you can go there first. Again, if there's an opportunity and then, under different funding streams, we want this to be the kind of the place of last resort simply because of the length of time, as Michael mentioned, we have longer to spend it. And also because there's just, we know that there's a lot of opportunities out there and we don't want folks to miss it, especially if there's some direct expertise on that type of activity as well within DNR, et cetera. So, yeah.
Okay. Amy, you got a question for us?
Yes. Somebody asked, did I understand you to suggest an FQHC, which is a federally qualified health center, in North St. Louis would qualify for CDBG CD dollars? Now, I'm not positive on that one just because of the federally qualified health center.
I think I don't believe it's a unit of general local government.
So the applicant would have to be a unit of general local government. So perhaps the FQHC could team up with the city or county government to do that, but on its own, it wouldn't be an eligible applicant for CDBG.
One item that I think we should flag in that situation is the potential for duplication of benefit, because if the entity has a strong funding stream already from the federal government, these are federal dollars, we can't lay federal on top of federal. So do be aware of that as you are moving forward with that. I do just want to do a quick time check for everybody. We are at just about 4:15, which means that we are firmly on the dark side of our presentation. We've got about just over 15 minutes left. We're not quite there, but almost. So just for everyone's awareness, we only have about technically 16 minutes left of Q&A here, but I just want to make sure that everyone is aware that we will be wrapping up 4:30. Just a reminder.
Okay. Marina, what's our next question?
Are the funds strictly linked to COVID-19, or can we take into account preparation for this and future pandemics?
Response.
Yeah, so I was going to say, so again, CV dollars are aptly named specifically for COVID-19. And as a result, the requirements, if we're thinking about that Oreo cookie, that creamy center is in fact preparation, response, and prevention of COVID-19. We have no control over whether or not there be any changes down the line from the federal government as far as what they might want to make this applicable for, but at this time, that is strictly COVID-19 dollars.
Okay. Candace, do you have a question for us back there?
How will the CV funding treat an infrastructure project where construction won't be complete for a year or more? How do we still make a connection that these projects will be to prevent, prepare, or respond to COVID?
I think that's a really good question, and there are lots of question marks about like how long the. What's up? Oh, apologies. The question was, how will the CV funding treat an infrastructure project where construction won't be complete for a year or more? How do we still make a connection that these projects will be to prevent, prepare, or respond to COVID? So there are some things we know and that we don't know. What we do know is these funds have a life of over 3 years. We have to spend most of them within 3 years. So a project of that timeline, that would be fun. That tie back, though, I would think about response in particular. I think that would probably be easier than prevention or preparation. And that's hopeful that everything goes well with vaccinations, herd immunity, et cetera. But if I were you, I'd really focus on the response piece of that and looking at the large impacts of COVID in that community.
Okay. Amy, do you have another question for us?
I think this might be our last question from the Q&A chat, unless anybody wants to add any new ones. This last one is from one of our entitlement communities for the state of Missouri, the city of Florissant, just asking because they are an entitlement, would they be able to apply for small business projects? And the short and sweet answer would be yes under the CDBG CD. dependent upon what small business projects you were doing and their ties to the COVID-19. Prepare your response.
And I think I'd like to build on that answer just a little bit, Amy. One of the things is, first of all, it would be the local unit of government that would need to create the program in which those small businesses would get that support. And so it would be within their application. And within that application, that direct tie back to CV would need to be there, to COVID would need to be there. Second of all, there are a lot of great resources currently available to support small businesses, including administered through the SBA as well as the PPP. So if we think about kind of the funding of last resort, I just want to reiterate to folks that, we really want to keep our eye really keenly peeled on the priorities relative to healthcare and some of the other ones that we have articulated already in the presentation. So understanding that there are some great opportunities currently for small business support. This is certainly an eligible activity for UGLUGs to provide an application on. But I do want to just ensure that folks recognize, the very specific tie back and documentation for it. All of the other eligibility criteria apply. LMI, the elimination of slum and blight, urgent need, those things all apply to these dollars as well. And so, keep those kind of factors in mind as you're building out your programming or your potential application.
Okay, and with that, I think we're going to go ahead and conclude today. All right, let's go ahead and take a look at the screen one last time. If you have any other questions, comments, you need to get a hold of us for anything, go to mocdbg@ded.mo.gov for your emails. Of course, you can go to ded.mo.gov online for the CDBG website. We have a CV page that's up and running now. And that's where you're going to be able to find the applications once the cycle opens. And I just want to take some time to thank Director Dixon for being with us today. I'd like to thank Michael Lanahan, Mary Rajek, and all of our question call screeners and everything. And thank you all for participating in the polling and the survey. And we're excited to see what projects we have laying ahead of us. Thank you all very much. Have a wonderful day.